Hi everyone, this is Guneet and today I have Dr. Vijita with me who is the Clinical Director of Rehabilitation Practices at Medigens, and today we are coming up with a very different topic with a discussion around neurorehabilitation specific to stroke patients, and we are going to discuss whether it's possible for stroke patients to lead a normal independent life after they have suffered from stroke, and also address some of the misconceptions that people usually have about recovery after stroke and what are the treatment methods that are available and how neurorehabilitation plays an important part in their recovery. So Dr. Vijita, I would like to discuss it with you that, let's start from the basics, that what exactly is stroke, what are the types of stroke, and, what are some of the implications that stroke has on patients' life.
Thank you so much, Guneet, for introducing me. You must have heard commonly about heart attack. Stroke is nothing but such kind of attack which happens in the brain. So, there's a clot, or sometimes there's a burst of the artery in the brain. Like in the heart attack, there's a clot in the artery, and the part which the artery is supplying, that gets compromised with the blood supply. Same happens in case of stroke. There's a major artery. There is a clot which gets stuck in that, and the blood supply to the remaining part of the brain gets compromised. The brain gets compromised of the nutrients which has to be supplied, and the brain being the supreme power in the body, it causes a lot of physical impairments, like mobility issues, speech issues, there are balance issues, there are coordination issues which the patient suffers after stroke. This is basically a crux of what stroke is.
Mm-hmm. Okay, so how does stroke exactly affects the patient's lifestyle or maybe day-to-day activities? Does it lead them to a completely dependent life, or is it possible for them to recover?
Well, that depends basically on the type of stroke which the patient suffers. So there are two types of strokes. One is hemorrhagic stroke and one is ischemic stroke. So the ischemic stroke is more common, which I said as which is the clot stroke which happens, and the hemorrhagic stroke is the one in which the artery completely bursts. So that accounts for less than 13% of all the strokes. So basically, after ischemic stroke, the physical implications on the body is limited. In the sense, if the stroke happens on the right side of the brain, the left side of the body gets compromised. There are movement disorders. There are spasticity in the muscle. The patient loses the ability to do activities on his own. There might be bowel and bladder issues. This happens in case of ischemic strokes. But in case of hemorrhagic stroke, since the blood artery has a burst or something, so in that case the implications are very wide in nature. The symptoms are not specific to one part of the brain, since because the blood supply gets distorted all over that place. So speech might be issue. The speech issues might be there. Then swallowing issues might be there. There might be complete loss of walking patterns. So after hemorrhagic strokes, the recovery is possible, but it takes more time than recovery in ischemic strokes.
Okay, okay. And so what role exactly does outcome-based rehabilitation programs have for such patients? So for example, a patient who has suffered from stroke maybe 2 months ago, and for a patient who has suffered from stroke 2 years ago, is there a difference in the program? And how do we assess as to, what's suitable for them to recover?
Yes, the time does matter, but it is not that the recovery is not possible if the treatment is not provided within 6 months or within 4 months of the attack of stroke. After, like, if the patient suffers stroke today, and if he or she is subjected to rehabilitation immediately, obviously the chances of recovery is much faster. So basically, after stroke, the muscles go into non-use syndrome. The muscles lose the capacity of working. They have not forgotten how to work, but obviously the functional activities of the particular muscle group have got compromised. So in that case, like if the patient starts taking rehabilitation program after 4 years, the time would be more, but that it is not that the patient would not get recovered. So this is what outcome-based rehab is. We analyze the patient's condition, present condition, the past medical history, the family history, the gender. So we basically direct the rehabilitation program according to what the patient requires at that point of time, and that is how we focus on the outcomes. So this is the main aim of outcome-based rehabilitation, to get the patient independent to what he or she basically requires, not as a generalized protocol.
So this is actually very important for our viewers, because there are many stroke patients who and their families as well. Because of lack of infrastructure, or maybe lack of expertise, it's not, they practically do not know that there is any availability of outcome based neuro rehabilitation programs that can actually help make patients as independent as possible, even after suffering from stroke maybe a year ago, or year and a half, or 2 years ago. It's just that the duration of the program matters, and the consistency in attending the rehabilitation sessions, it matters. So have you had cases wherein patients had neuro rehabilitation done, whether neuro rehabilitation remotely, or maybe in clinic visits, wherein the patient has been able to, who was maybe completely dependent on the family, and they have been able to return to their normal routine and independent lifestyle?
Absolutely, absolutely. We have had patients who suffered stroke perhaps 4 years back. They were subjected to rehabilitation, particularly on the issues which were compromised for a long time. They were not subjected to the generalized protocols which are followed, only to the particular muscle groups which were compromised for a long time. And the patients have been able to get back to their work. They have been able to get back to driving. They have been able to get back to playing sports as well. So recovery is possible, because the main thing behind this, that there is no laceration in the nerve. The nerve supply to the muscle group is not cut in stroke. It is not an accident case. So it is just that the supply is slow. So if we continuously subject the brain to such kind of activities, the recovery is possible. And talking about telerehabilitation, yes, the patient should not get compromised or be devoid of rehabilitation program if they cannot attend to a physically set up rehab centers. Telerehabilitation is equally effective in the case the therapist can demonstrate exercises from their clinic, and the patient, with the help of any family member or a attendant, can do the same procedures at home. So we have given results to patients in such cases who could not come to the center, and we have subjected them to 6 to 8 months of rehab programs, and they have recovered remarkably well in such cases.
And this is again a very useful piece of information for patients who are, who do not have the muscle strength, or maybe the family is not able to transfer them abroad for specialized care for any kind of neuro rehabilitation program, or the patient suffers after stroke. There are mobility issues, and the patient cannot be transferred easily. So it's also very important for them to know that neuro rehabilitation is also possible through telerehabilitation programs, as well as in, you stay there, back there at home, one of our experts will be there on the video call with you, and help you perform exercises, and also assist the patients in performing certain movements and exercises that will slowly help them recover from stroke, and also increase the muscle strength, so that they are able to return to their normal lifestyle. So what exactly, this would probably be the last question, what exactly should a patient expect in terms of outcomes if they enroll for such neuro rehabilitation program?
So as I said, Guneet, it all depends on the patient's condition at present, and what all goals he has in mind, or the lifestyle in which he or she was used to before. So according to the present condition, according to the past evaluation of the medical history, of the family history of the patient, we set up the protocols, and according to that, the outcomes would be delivered. Patient can expect a remarkably well improvement in their gait patterns, that is walking patterns. Patient can expect remarkably well results in their muscle strength, in balance and coordination, in speech, even global aphasia, that is the patient has lost especially in case of hemorrhagic strokes, the patient sometimes loses the capacity of speaking even for 6 months. But with continuous rehab programs in speech, the patient can recover their speech as well. The patient can have good control over the bowel and bladder. The patient can get back to community living in a normal way like you and me do. So these are the outcomes which can be expected out of rehabilitation, especially neurorehabilitation.
Okay, thank you so much for taking out time for this session today. So, we covered more or less the most important things about stroke today, and we will be back for another session to continue our discussion as well. So, as a last word, this is very important for stroke patients who suffer from mobility issues or speech disorders or some those who have some serious implications of stroke. It doesn't matter whether you have had a stroke 1 month ago or maybe a year ago or 2 years ago or even 4 years ago. There have been patients who have been able to slowly return to their normal lifestyle through the customized approach, through the protocols that are prepared after a complete assessment. So those could be 1 month programs, 3 months programs, 6 months programs, or even 12 months programs that can be delivered on site as well as remotely. So if you have any questions, or if you know if you know someone who needs help with respect to stroke rehabilitation, feel free to contact us, and our team and Dr. Bijita will be personally involved in making an assessment and producing the outcomes through the programs. Thank you so much.